So, let's talk about something that can be really unsettling for a lot of families, that watchful waiting period for mild childhood scoliosis. It's that time right after a diagnosis, where the official advice is just to monitor. And for parents, it can feel like you're just sitting around waiting for the other shoe to drop. Today, we're going to explore a different way to look at that time.
And this question right here, it's really at the heart of everything we're discussing. If you're a parent who's heard these words from a doctor, you know exactly what this feels like. It's this weird mix of relief, because, no surgery is needed right now, but also this deep, nagging anxiety. What are you supposed to do during these crucial months, maybe even years, of growth? It honestly feels like you've been left in a lurch.
But this is where things get really interesting. This quote comes from the core position statement of a framework proposed by Dr. Levna Motin, and it's such a powerful idea. He's saying that this waiting period isn't just empty time. It's not biologically inactive. It's a potential window of opportunity, a chance to take a more active, a more informed approach to just observing.
Now, let's be super clear here. Watchful waiting is sound medical practice. A lot of mild curves, they just don't get worse. But the problem is how that clinical prudence feels to the family on the ground. It often feels like this long, drawn-out period of uncertainty. You're watching your kid grow, you know there's this imbalance, but you haven't been given any specific tools to do anything about it. And that is the gap we're talking about today.
Sometimes a doctor might suggest physical therapy during this waiting period, which is great for a child's overall health. But typically, this kind of PT is all about general conditioning. It's symmetrical exercises, stuff for core strength and flexibility. And while that's all good, it usually doesn't zero in on the specific neuromuscular imbalance that the X-ray is showing.
In this chart, it lays out the difference perfectly. On one side, you've got your standard physical therapy. The goal is general fitness, the method is symmetrical exercises. But on the other side, you have this proposed neuromuscular framework. The goal is way more specific, to address that neuromuscular asymmetry. It's not just about getting stronger, it's about trying to rebalance the specific muscles holding up the spine.
All right, so let's get into the why behind all of this. To really get it, you have to remember something absolutely crucial. In a growing child, an early-stage scoliotic spine isn't some rigid concrete pillar. It's flexible, it's dynamic, and it's constantly responding to all the different forces acting on it every single day.
So, the key concept here is this big phrase, neuromuscular asymmetry. It sounds complicated, but it's actually a pretty simple idea. All it means is that the muscles on one side of the spine might be firing more or just working harder than the muscles on the other side. And over time, especially during those big growth spurts, that kind of imbalance could potentially influence how the spine is aligned.
This is the absolute best way to picture it. Imagine there's a constant, tiny game of muscular tug-of-war going on around the spine. Now, if the team on one side is already stronger and your training plan is to make both teams stronger equally, well, you're not actually fixing the fact that one team is winning. You might even be making them win by more. That's why just doing general symmetrical exercises might not be the whole answer.
So what's the alternative being proposed here? It's a very conservative, home-based framework that's designed specifically for this observation period. And listen, it's not a treatment or a cure. It's more like a structured, safe way to explore neuromuscular engagement while you are still under your doctor's care. The logic is actually really simple but pretty clever. Instead of strengthening everything, the strategy is deliberately asymmetric. The whole idea is to gently wake up the muscles on the inside of the curve, that's the concave side, the ones that maybe aren't pulling their weight. At the very same time, you consciously avoid exercises that would strengthen the already dominant muscles on the outside of the curve, the convex side. The goal isn't to physically push the spine straight, it's to try and rebalance the muscular support system around it.
So how does it actually work in practice? Well, it's broken down into 3 really simple parts. First, you do a basic symmetry exercise just to get a neutral baseline. Second, and this is the core of it, is this localized rhythmic engagement on that concave side to kind of nudge those underused muscles to turn on. And third, there's an optional little micro massage, which is more for comfort and just giving the body some sensory feedback. It's all designed to be super manageable to do at home.
And here's one of the best parts. This whole approach is built on consistency, not intensity. This is not about long, painful workouts. We're talking about short little sessions spread throughout the day. Maybe a few minutes in the morning, a few at night, adding up to only about 10 minutes total. The idea is that for kids, frequent, gentle repetition is way more effective for this kind of neuromuscular learning than a big, tough workout once in a while.
Okay, let's pause for a second and talk about what is, without a doubt, the most important part of this whole discussion: The boundaries, the safety rules. Any home-based program, especially when it involves kids, has to be built on a rock-solid foundation of safety. And this framework is crystal clear about its limits.
First and foremost, and this is completely non-negotiable, this is not a replacement for your doctor. It is not a replacement for bracing, if that's recommended, or for surgery. It's designed to be used alongside standard medical care, not instead of it. Think of it as an exploration, a way to be active during the wait while your doctor stays 100% in charge.
So what does that mean day to day? It means all of these activities are gentle. They don't apply any harsh force to the spine, there's no cracking or manipulation, and they should never, ever cause pain. The golden rule is simple. If anything feels off or uncomfortable, you stop. Period. That makes the whole thing fundamentally safe.
So the big question, how do you even know if this is doing anything? The answer is incredibly clear and objective. The follow-up X-ray that your doctor already scheduled. That's it. We're not guessing. We're not going by how things feel. The clinical imaging tells the entire story, which keeps the doctor's authority completely intact.
And this right here is the ultimate safety net. If that follow-up X-ray shows the curve has actually gotten worse, you simply stop the program, and the standard medical plan, whether that's talking about a brace or whatever the next step is, it all proceeds exactly as it would have anyway. There's no delay, no time is lost, nothing is risked.
So when you step back and look at the big picture, what this framework really offers is a new perspective. It completely reframes that whole experience of watchful waiting from something you just endure into something you can actually participate in.
And this, I think, is the real game changer here. For families who feel so helpless in the situation, this gives them a structured, low-risk, and genuinely constructive role to play. It changes the whole story from, we're just sitting here doing nothing, to, we are actively and safely exploring our child's neuromuscular balance. It's empowering.
And all of this leaves us with a final, really powerful question to think about. This framework isn't presented as a magic bullet. It's presented as a hypothesis, an exploration. And it asks, could we be using this period of clinical observation more constructively? Could a more active, more informed approach to just watching actually change how we manage early-stage scoliosis down the road? It's a fascinating idea that really challenges us to rethink what it means to watch and wait.